Welcome to the Special Education Assessment process. I'm Dr. Julie Lane and I am your instructor for the course. I'm actually a full-time faculty member here at Fresno Pacific University. I teach in the School of Education and am very passionate about providing foundational information to educators around the world, especially here in the United States, to help give a basic understanding of the children that we serve. I'm looking forward to serving you during this time, and please never hesitate to reach out if you have any questions. My contact information is at the top of the syllabus. So away we go. Here's our first module and the video that provides the introduction, the 13 categories. We'll talk about this more at length in a module later on, but I want to start off our time together by making sure that we all understand that the Rehabilitation Act of 1973, where we find Section 504, is not special education law. It's anti-discrimination law or civil rights law, and it came well before the introduction of special education law in our country. It provides accommodations for individuals who have demonstrated a physical or mental impairment that substantially limits a major life activity. And a major life activity for a child is the right to a free and appropriate public education. There must be a record of such impairment, and all children and adults with disabilities are protected by Section 504. So as we move through the material, really make a note of it, that Section 504 is not special education law. Special education law came about in 1975 with the Education of All Handicapped Children Act. In 1997, it was renamed the Individuals with Disabilities Education Act, and in 2004, it was renamed again as the Individuals with Disabilities Education Improvement Act. Please note that even though the name was changed in 2004, we still talk about the law as IDEA, as it was named in 1997. The law was signed in 1975 under President Gerald Ford, and it required all states that accepted money from the federal government to provide an equal access to education for children with disabilities. It provided children with disabilities one free meal a day, and states had the responsibility to ensure compliance under the law within all of their public school systems. It was reauthorized again in 1976, and at this time, it required that individual states provide services to families of children born with disabilities. Later on in our course together, we will talk about the Individualized Family Service Plan, and that is when this plan came into effect. In 1986, President Reagan signed the Handicapped Children's Protection Act, and this gave parents of children with disabilities more say in the development of their child's individualized education plans. Prior to this time, there was no obligation to engage parents in the educational process of their child with disabilities. In 1990, traumatic brain injury and autism were added as categories under the law. And Congress mandated that as part of a student's IEP, an individualized transition plan, or ITP, must be developed. And we'll talk more about the ITP later in our time together. When the law was reauthorized in 1997, as previously mentioned, it was renamed. President Clinton signed the reauthorization, and it required that all students have access to the same curriculum, that states were given the authority to expand the developmental delay definition, which had been from birth to age 5, and it extended it to age 6 through 9. In 2004, the law was reauthorized again, and it calls for early intervention of students, greater accountability, and improved educational outcomes. Here is where we had the introduction of response to intervention. It was actually written into the law as a requirement to help keep students out of special education by identifying them early on and giving them the interventions they needed. It raised the standards for instructors, becoming highly qualified, and it requires the states to demand that local school districts shift up to 15% of their special ed funds toward general ed funds if it were determined that a disproportionate number of students from minority groups were placed in general education for reasons other than disability. Here is where we talk about overrepresentation of minority groups who were not assessed appropriately and placed in special ed programs. Again, we'll get into that more later on in the course. The 13 categories under IDEA are listed here for you. Specific learning disability, speech and language impairment, other health impaired, autism, developmental delay, intellectual disabilities, emotionally disturbed, multiple disabilities, orthopedic impairment, traumatic brain injury, visually impaired, hearing impaired, and deaf and blind. This slide provides you insights of where we were back in 1976-77 and where we are as of 2019 in the identification of children ages 3 to 21 years of age. You can see from the grid how many areas such as autism, where we didn't even used to collect data, has now expanded and has continued to grow. We also look at traumatic brain injury, again, not identified early on, and although it hasn't had a growth, it does sustain itself as an area in which we need to spend time identifying children who've had traumatic brain injuries. If you would like to examine the graph more fully, feel free to stop the video at this time, and then after you've examined the graph, feel free to jump back in again. So let's talk about specific learning disabilities. A specific learning disability, as defined by the law, it means a disorder in one or two of the basic psychological processes, whether that be language, spoken or written. It must manifest itself in an imperfect ability to listen, think, speak, read, write, spell, and perform math. It also includes what used to be called perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. I'm aware that many states actually identify dyslexia through the assessment process. However, federal law says that if you're dyslexic or have dyslexia, it's just held within the specific learning disability area, and there's no need to call it out as something separate. Granted, this is a philosophical approach, and some people would argue very differently. What we must be very attuned to is that a learning disability cannot be diagnosed for someone who has not had the opportunity to learn. So we must make sure that when we diagnose someone with a learning disability, that they have had the same opportunity. Now, if we look at the very last paragraph on notwithstanding any other provision of law, we want to zero in on the section that indicates that we cannot only use the old discrepancy model to identify a specific learning disability. That was when your IQ and your achievement levels had to be so far apart on a bell curve. There had to be a significant discrepancy. And yet we no longer use that model. We can assess using the discrepancy model, but we cannot keep a child out of special education simply because they do not qualify based on the discrepancy model. We must then institute response to intervention, or RTI. Lastly, the law does include, as noted, very specific language about using a scientific research-based intervention, which is RTI, in determining whether or not a child has a specific learning disability. So how does a student qualify? You can use the discrepancy model, but not in isolation. Discrepancy must be demonstrated through scientific research-based interventions, or RTI, and no longer need a severe discrepancy to qualify as having a specific learning disability. Specific learning disability characteristics do include poor organizational skills, failure to see consequences, awkward use of pencil or scissors, distractibility, hyperactivity, perceptual coordination problems, impulsivity, lack of organizational skills, and a low tolerance for frustrations and problems. They have difficulty in reasoning, difficulty in one or more academic areas, low self-esteem, problems with social relationships, difficulty beginning or completing tasks, uneven or unpredictable test performance. They could do great one day and then do poorly the next day. Sequential memory deficits, visual sequential memory deficits, auditory processing, and visual motor coordination problems. Memory is also a tricky area for individuals with specific learning disabilities. Think of your memory as a filing cabinet, and we pull out information, we share it, we talk about it, and then we refile it. For individuals with learning disabilities, many times when they pull the information out, they put it back in the wrong place. We often see this when students start to stammer over trying to find the right word that they want to use. It's because they filed it in the wrong place and they're trying to relocate it. It's the same reason why a student can do really well one day on a test and take the test the next day and do terribly on it, because they refiled the information incorrectly. So memory is reception, storage, and retrieval. And those are the three mechanisms that keep our memory organized. We have to receive the information, we have to understand it, we have to store it, and then we have to be able to find it in our memory to pull it back out. The types of memory: rote memory, short-term, working, sequential, and long-term. We see rote memory when we memorize our math facts. Short-term memory when the teacher gives a student a direction to go somewhere and come back. Working memory, and we'll talk more about this later in our time together, but it's the ability to hold on to and manipulate information and then regurgitate it. Sequential memory, this goes with storytelling, our ability to tell a story in sequence, or our ability to understand the steps we need to take to get organized every morning to go to school. And of course, our long-term memory is where we retain information for a very long period of time. Auditory processing, which is an area that is tested when we're testing for specific learning disability. It's a natural process of taking in sound through our ears and having it travel to the language area of our brain to be interpreted. Auditory processing has nothing to do with our physical ability to hear or having a hearing impairment due to deafness or just poor hearing ability. Auditory processing is how we process what we do hear. Many auditory abilities develop during the early years, and when children have lots of ear infections, their auditory abilities can be affected. Academic instruction typically presumes that children have acquired these skills already, and for children with potential learning disabilities, they have not. Poor readers have auditory, linguistic, and phonological difficulties. Characteristics that we should look for: inattention, and poor listening skills, remembering information presented in an oral manner, inability to follow multi-step directions, low academic performance, poor expressive or receptive language, behavior problems, easily distracted, delays in responding to questions and instructions, and often misunderstands directions or instructions. So our auditory memory then is the ability to store and recall what we hear, the ability to listen to multi-step directions, such as the components of a 5-paragraph paper or a lab report, and being able to store and recall those directions given. Auditory sequencing, the ability to remember things in order, things that we have heard. I think of time out on the playground or in PE, when children are given many directions on what they need to do in order to play a game, and they can't retain it all. Auditory blending, the blending of sounds, and the ability to blend a single phonic element or phonemes into a complete word. In other words, they struggle with the ability to sound out a word. Visual processing, the ability to make sense of information taken in through the eyes. This does not mean that the child has a vision impairment and they need glasses. It's how we process the information that comes in through the eyes. Children with visual processing concerns cannot bring meaning to what is on the page. This can sometimes result in left-right discrimination, the flip-flopping of B and D or P and Q, poor depth perception, and the inability to see the forest. They only see the tree. Visual perception plays a significant role in school learning. It requires the ability to discriminate between geometric designs, pictures, letters, and words. I will add in there reading a map is a challenge. Understanding complex algebraic formulas on the page. Spatial relationships. B, D, P, and Q are all balloons with sticks on them, and yet we turn them in different directions and they become 4 different letters with 4 different sounds. Perceiving the position of an object in space. Object recognition, the ability to recognize the nature of objects when viewing them. Whole versus part perception. For me personally, I'm a whole to part learner. I need to see the big picture, and then I can tear it apart into its small parts. But give me a whole bunch of pieces. I struggle more so to put them together into something whole. So part perception, the tendency to focus on immediate details and miss the whole. That would be me. Granted, that has developed over the years and not so much as when I was a child. But both the whole perception and the part perception are needed to be effective learners. Well, what about speech and language impairments? It's a communication disorder with morphology, syntax, semantics, and pragmatics, and how those affect a child's educational performance. So let's look at morphology, the study of how words change from one form to another, such as tap to tapping, biology to biological. Syntax, the sequence of words in a sentence, how the words are arranged to make sentence grammatically correct, often the omission of articles. But when we think of children where English is a second language, or even immigrants where English is a second language, oftentimes they omit the articles as they speak. So is this a disability area versus is this the practice of learning English? Semantics, the study of how words are used to make meaning, includes studying the relationship between explicit and inexplicit meanings. One of my favorite ones is smells. When we say something smells, we automatically think it's a bad thing. And yet we think about perfumes that can smell quite lovely. But that's not what we have created that word to mean. Analogies are wonderful too. Finding the hidden meaning within an analogy can be extremely difficult, especially for our children with autism. And then pragmatics, the study of using language, knowing how and when to speak, knowing what to say and how to deliver speech. For children with autism, we don't see the ability to interact and engage in speech that we typically would like to see. Speech deficits. A speech impairment means a sound system disorder, whether that's in articulation or phonology. It's a delay of correct sound production. We often see this in young children who have had multiple ear infections during their toddler years. They didn't hear how to pronounce a sound, articulate a sound correctly, and often find themselves receiving speech therapy in order to catch up. But this area also includes those who have stutters, who speak at a very high pitch, or the quality or the volume of their speech is not what we would perceive as being typical. Moving on to other health impairments. Other health impairments means having limited strength, vitality, and alertness within a given area. Many children who have other health impairments, such as hyperactivity disorders, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette syndrome, often these students are placed on a Section 504 plan because all they need are accommodations. They don't need special education services. But there are those students who do need more intense services and supports, and then they are placed on a IEP or IFSP. Since other health impairments is a health issue, a physician must do the diagnosis. Schools may not diagnose other health impairments because they are health issues, and that includes areas of ADD and ADHD. For autism, this is the fastest growing area and has been for almost 20 years now. Children are being diagnosed with autism at incredible rates. For a long time, autism was divided into different groupings, but in 2015, when the Diagnostic Statistical Manual on Mental Disorders was published, areas such as pervasive disorders and Asperger syndrome were all pulled together underneath the autism diagnosis. And this is why we call autism a spectrum disorder, because children who fall on the spectrum range greatly in their ability to be verbal and nonverbal, their ability to be socially interactive. And we have to keep in mind, autism does not define or describe all children who fall under autism. It's too broad of a category. Autism characteristics is really around the concept of communication, delay or lack of spoken language, delay in ability to initiate or sustain conversations, stereotyped and repetitive use of language. Impairments are restricted, repetitive patterns of behavior, restricted patterns of interest and inflexible, adherence to specific non-functional routines or rituals, lack of varied, spontaneous, social, imitative play, preoccupation with parts of objects, repetitive, stereotypical motor mannerisms, and what is different for each child is the frequency and severity of the symptoms. So let's touch on Asperger syndrome, just briefly. Impairment with nonverbal behaviors such as eye gaze, facial expression, body posture, and gestures. Failure to develop peer relationships at the developmental level, and lack of social emotional reciprocity. Impairment is restricted, repetitive patterns of behavior. They have restrictive patterns of interest and inflexible adherence to specific non-functional routines or rituals. Lack of variety, spontaneous, social, imitative play, preoccupation with parts of objects, and repetitive stereotypical motor mannerisms. The disturbance causes significant impairments in social, occupational, and other areas of functioning. No significant general delay in language or cognitive development. Children who would have been classified as Asperger syndrome often have high IQs. They often engage in one-way conversations. However, they are of high intellectual content. Developmental disabilities. As mentioned previously, the age category for this was extended under the reauthorization under President Reagan. Children aged 3 through 9 experiencing developmental delays qualify underneath this category. This category is used when those who assess the child really can't come up with a specific area of need, but they know that something may be up. They are measured by appropriate diagnostic tools and procedures in physical, cognitive, communication, and or social development. They look at adaptive development. Someone with a developmental disability is measured by appropriate diagnostic instruments and procedures in one or more of the following areas: physical, cognitive, communication, social or emotional development, or even adaptive development, and who needs special education and related services. Intellectual disabilities was renamed from mental retardation back in April of 2011. And an intellectual disability is a disability characterized by significant limitations, both in intellectual functioning and in adaptive behavior, as expressed in conceptual, social, and practical adaptive skills, and it must originate before the age of 18. Emotional disturbance is the condition exhibiting one or more of the following characteristics over a long period of time, and to a marked degree that adversely affects the child's educational performance. An inability to learn that cannot be explained by intellectual, sensory, or health factors, or an inability to build or maintain satisfactory interpersonal relationships with peers and teachers. Children with emotional disturbance, inappropriate types of behaviors and feelings, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms or fears associated with personal or school problems. Emotional disturbance includes schizophrenia, and the term does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance. Multiple disabilities simply means that there are more than one area of disability in the 13 categories. Bringing together 2 or more of those areas creates the diagnosis of multiple disabilities, and then a clear understanding of what those multiple disabilities are. The one exception to this is it may not include deaf-blindness. Orthopedically impaired are those who have a physical disability that they could have been born with, it could have been caused by disease, or impairments from other causes. Common diagnosis under orthopedically impaired is cerebral palsy. It's most prevalent in the area of orthopedically impaired with 2 types of hypertonia and ataxia. Spina bifida, weakness, paralysis, motor function impairment, and spinal cord injury. And that percentage is rapidly increasing. Traumatic brain injury. Traumatic brain injuries are specific to the injury, whether that's within the womb or outside the womb. However, traumatic brain injuries are not the result of congenital or degenerative injuries, nor those induced by birth trauma. So traumatic brain injury means an acquired injury to the brain caused by an external physical force, resulting in total or partial functional disability, or psychosocial impairment, or both, that adversely affects a child's educational performance. Traumatic brain injury applies to open or closed head injuries, resulting in permanent impairments in one or more areas, such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical functions, information processing, and speech. And again, traumatic brain injury does not apply to brain injuries that are congenital or degenerative, or to brain injuries induced by birth trauma. Brain injuries can be mild to severe. They can be the result of an accident, illness, or child abuse. Visual impairment includes blindness, means an impairment in vision that, even with correction, meaning glasses or contacts or eye surgery, still adversely affects a child's educational performance. The term includes both partial sight and blindness. Hearing impairment means an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance, but that is not included under the definition of deafness in this section. Deaf-blind means that both the child is deaf and the child is blind, the combination of which causes such severe communication and other developmental educational needs that they cannot be accommodated in special education programs solely for children with deafness or children with blindness. And lastly, I would really like for you to check into your own state to see if there's a 14th category. Here in California, we do have a 14th category, and it's called Established Medical Disability. It's restricted for children ages 0 to 5. It's used to identify a child needing services, but yet they don't quite qualify in any of the other 13 categories. So you might want to check it out and see if your state has an additional category, or maybe two. I know we just covered a lot of information. Feel free to go back and watch the video, stop in places, take notes, and be sure to reach out to me if you have any questions on any of the categories, or would simply like to share information about another category your state has. So as we jump into Module 1, watch the video on everything you need to know about special education. You're going to read Step 1 in our text, watch the 14 categories, take the quiz on the 14 categories, then submit your characteristics reflection on what do you think about all these different categories that we have. Read Step 2 in our text, then read situations that put youth at risk, and then submit your student scenario. I'm really looking forward to working with you over the next few weeks or few months. Just always make sure that you reach out to me if you need anything. My information, contact information, is at the top of our syllabus. Enjoy.